Let's have a quick word with Torrin Govind, our favourite pharmacist, because apparently there's a lot of pharmacies closing down and it's having a huge impact on those people who need to access them. 430 permanently shut their doors last year. That's an awfully large number. Torrin, a very good morning to you.
Morning, Mike. Again, we are talking about a lack of understanding about the value of community pharmacies on our high street. So, yeah, 8 pharmacies closing each week. That's what they found with from 1st of January to 31st of December 2023. And we've talked before about this, Mike. We've got the inflationary pressures on the pharmacies. We've got the 40% cut in funding since 2015, which still hasn't been rectified. We just keep being given more work to do with no more funding for it, quite frankly, because we've still got everything else in the background that needs to be done. Those dispensing, when you go into your pharmacy and we're running around trying to sort out the prescription, there's no more money for us doing that. And then there's staffing issues. There's easier places to work than a community pharmacy where there's far less risk.
Is it possible that the reason why they're closing is just because there's too many of them? I mean, is it possible that maybe they can't all make enough money or something like that?
So about 73% are operating at a loss at the moment. Right. So part of the closures is the funding issue. What I would say is what happens is if the pharmacy, even temporary closures, so whilst you might think you walk down the high street and there's a couple of pharmacies, they're only catered to deal with the population that they have. Right. Because then when another closes, you know, I've been in this situation, the other pharmacies close. I've had a huge deluge of people through my doors, which I haven't been able to cater for because we've had to increase waiting times. It puts huge amount of pressures on the people who are open when another pharmacy closes. But ultimately, the patients are impacted by this. And if I was a patient, I'd be saying, why is my access to healthcare dwindling? Why am I not able to? Why is it a reduction in care available? And that's the key point here, isn't it? Yeah. Why should we be suffering like this? Because people are suffering because of this. And we've got Healthwatch have got quotes. I know patients who've come to me and said, oh, that pharmacy's closed. But please support your pharmacies. We are there. It's hard work in the pharmacy. And we've spoken about this before, Mike, the medicine shortages as well that we're having to deal with are still going on. But, you know, come on, where is the support for us? You can't just clap for us. We do need some funding and we need some recognition that we are an important part of primary care, just like, you know, your GP, your optician, your dentist. We're all working together. Well,
the Tories were very keen to make more of the pharmacies, weren't they? They wanted pharmacists to do more stuff which could be done otherwise by GPs to sort of try and take the weight off the GP surgery. Is Labour continuing with that policy? Do they want to do the same thing?
Well, we're still waiting for the contract to be negotiated, Mike. And obviously, we've heard about lots of.
Well, you should be fine. Just tell them you go on strike unless they give you what you want, and then they'll just give you 15%, like they gave the train drivers.
So, big challenge in the pharmacy for us is we would be we work under an NHS contract, so we would be breaking that NHS contract if the owners decided to go on strike. So it's quite complicated. They are doing a ballot on whether they're going to reduce services or work to rule. Yeah. So that is going on at the moment. But I don't want to be in this situation. We want to talk about good things in healthcare, don't we, Mike?
Well, you don't want to go on strike, really, no. But of course, the point is that, you know, the general scenario seems to be if you're in the public sector, which I know you're not really, but if you're in the medical business, you shouldn't be treated any differently than the nurses who have rejected 5.5%, who just got 5.5%, than the doctors who just got 22%. You know, you might as well just go there and rip them off and take as much money as you can, because they say that they can afford it, even though they've got a £22 billion black hole. But listen, good to talk to you, Torrin. We haven't got a lot of time this morning, so I'm going to let you go.